absolutely delighted to be with you this evening on behalf of my IVF Answers and the European Fertility Society for this event based on social egg freezing. My name is Barbara Scott. I'm chair of the Association of Reproductive Reflexologists, and we have with us this evening Dr. Moreno, who's based in Barcelona at the Reproclinic, and will be talking for us about social egg freezing, a topic which I know is going to be of enormous interest and benefit to anyone who is considering this path in terms of preventative care or preserving fertility. It's an enormous topic that is gaining momentum for patients. So we're absolutely delighted to have Dr. Moreno with us. His specialism is actually in low ovarian reserve, and so that actually leads quite nicely into this as a topic, because of course women in that scenario will want to make sure that they are taking the best possible care of themselves and preserving their fertility at its optimum. So we're delighted to have you with us. One thing I will say just before we begin is that please do post questions. The questions are anonymous, so you can safely post questions, and we will answer those for you at the end of the session. But before we actually begin our session this evening, we do have something that we would like to share with you, a new initiative which has been launched by the European Fertility Society, which is a patient-centered care clinic program. So basically what this means is that clinics engaging with this program will go through a specific interview and assessment process that addresses their ability to engage with patients and ensure that patients are getting the best possible care. So they go through an interview process and a clinical process to assess how they are achieving that. And the first thing to say is that this whole program really is based on patient care. And the second thing to say very briefly is what it means for you as a patient is that you know that this particular clinic who have undertaken this process are actually very focused on their patient care and want to ensure that you as a patient are getting the best possible care that you can. So just a brief little introduction. So start looking out for that logo when you are choosing clinics. So I am now going to be delighted to hand over to Dr. Moreno, who is going to share his presentation and speak for us on social and social freezing. Thank you so much for being with us this evening.
Good. Thank you, Barbara, for the presentation. Well, today I'm very happy to be here with you. Today we're going to talk about this topic, social freezing. I have put in that presentation the most relevant information that patients need to know when they are thinking about doing this treatment. And of course, we will have time afterwards to discuss any particular case or questions that the audience may have. Okay, so let's talk first about precisely the concept, social freezing. So what is social freezing? Basically, this concept means on keeping eggs, okay, to be used later on life. Okay, that's easy as it sounds. Of course, afterwards we'll see all the particularities. Why it's becoming more common and common? Basically because it's a treatment that it's offer, or the potential patient could be every woman, okay, that has decided for any reason to postpone motherhood. Let's see more in detail which are the main reasons why women decide to do this egg freezing or social freezing currently. Most of them, it's because due to professional career or educational plans, they are not ready for childbearing. Or maybe they are ready, but they haven't found a partner. They don't wish to use a sperm from a donor. And of course, probably the most relevant are because of medical reasons. No, young patients with still a desire of motherhood, that for medical reasons, most of cases because cancer treatments, they need to preserve these eggs before the chemotherapy, because sometimes this chemotherapy could be, of course, toxic or could have a negative impact over the fertility potential on future. Okay. Perfect. Let's see briefly the technical part. Okay. So the treatment has mostly 3 phases. Okay. The first one, it's the hormonal stimulation. Second, the intervention, the egg retrieval, and third, the vitrification. Let's see each step in detail. Okay, so the stimulation. Basically, we need to understand that naturally every month the woman's body it's capable to produce one competent egg to be fertilized in a very precise moment on the cycle. Okay, but in spite of having the ovulation of just one egg, woman has many follicles. The follicles are the structures where the eggs are contained, and naturally every month women select just one of them. But this type of treatments allows us to use hormones, in fact the same hormones that the body uses to control this procedure, no, the ovulation. But in that case, we use those hormones in higher doses, and our goal, of course, is to recruit, to provoke what we call a multiple follicular response. Okay, so we have to understand that the more eggs, in general terms, the more eggs we have, so the more follicles we achieve through the stimulation, the better, because we'll have more eggs, and that will be better chances on the fertility prognosis. Okay. Technically, the stimulation, it's a process that normally takes around 10 days. That could be different in each woman, from 10 to 12 days. And basically, the stimulation means the hormone use are always given through subcutaneous injections. Okay, in general terms, it's not difficult to manage, and each patient normally it's capable to do it by herself. That stimulation takes around 10 days, as we've said, and during this process, it's needed to keep a follow-up. In general terms, we do around 3-4 pelvic scans, one at the beginning before starting the process. I haven't said that, but it's important to say. In general terms, these treatments are start during the first days of the period. Okay, normally at the second day, but it's true that nowadays we have different windows to the cycle, not only at the beginning, if not as well before the ovulation or after the ovulation, where these treatments could be started with the same results. Okay, so we're flexible about that, and our wish always is to try to make things as easy as possible for our patients. Okay, but as we've said, in general terms, during this period of stimulation, we'll need to do a certain number of ultrasounds, normally around 4, 1 at the beginning, and 3 during the whole process. Okay, the goal of this follow-up, of course, is first knowing, assessing how many follicles, so how many eggs potentially we may have at the end of the process, and second, we measure the size, the average diameter of these cystic structures, the follicles, because during the stimulation they will grow. Okay, and when they reach a certain size, it's when they are telling us this is the right moment to collect them to undergo for the egg retrieval. Okay, before going to the next step, it's important to say, let's say that during that part, during the stimulation, there are very frequent side effects. Most of them, they are variable. They shouldn't affect the quality of life, or they should not, normally they don't mean to stop doing the daily activity. The most common side effects, feeling of being bloated. No, this is normal. Most evident or most frequent at the end of the stimulation and after the egg retrieval. It's common as well to have more vaginal discharge and breast soring, sometimes breast tenderness, let's say, headaches, and sometimes the literature talks about mood swings as well. Okay, let's see again. Let's see the next slide. Perfect. The egg retrieval. That's the end of the process. Okay, so the moment where the patient undergoes to the surgeon theater, and through a very light anesthesia, basically a deep sedation, the procedure is performed. Okay, so that means that the patient is always asleep and won't feel any pain or won't remember anything about the process. Okay, the surgery takes no more than 15 or 20 minutes, and it's performed through the vagina. Basically, technically, it consists of introducing a vaginal proof, as the ones that are normally used to assess to perform the scans during the process. But that time, that proof allows us to introduce a very long and thin needle, and just passing through the vaginal wall, we reach the ovaries, and with that needle, we collect the eggs from both of them. Okay. Once we finish the process, the patient stays with us for a couple of hours to recover from the sedation and to receive some painkillers if they are needed. Normal, that same day, once the patient is discharged, she hasn't any kind of pain or maximum mild cramps. Okay, that normally are easily controlled through oral painkillers. Okay, afterwards, what happens with these beautiful eggs that we have recovered? So immediately after, immediately after the surgery, we assess the quantity of eggs in general terms that we have recovered, but normally 2-3 hours afterwards, we need to reassess them, basically to check which ones are mature and which ones not. Only mature eggs are frozen. Okay, and in general terms, from the total amount of eggs collect, normally we expect to have between 75 to 80% of them being mature. Okay, and that's the end of the treatment. Okay, so in resume, we can see that it's a treatment that takes around 2 weeks. Okay, from the very moment we start the stimulation till the egg collection. And it's important to say as well that after the surgery, we give some advices about just keeping, let's say, not performing any kind of exercise, taking the painkillers, but mostly after the surgery, the recover, it's easy, and in a week, 10 days, only patient feels completely normal. Okay. Perfect. The most important part, that's one of the piece of information that probably will be the interest of most of the audience of patients. So the key question, how many eggs I'll need to ensure having a child on the future? And that is not an easy question to answer, because that depends on many factors, mostly on age of patient. Okay. So there, you can find plenty of models, mathematical models, calculators online that will help you to calculate that number. But it's true, they could have differences from one to another. The numbers that I've put here are based in our experience and take into account the scientific papers published for that purpose. Okay, so in general terms, we can say that until 34, 35 years old, the quality of the eggs remains almost equal. So let's say for patients until until 34 years old, if we achieve to have 20 eggs, then that will ensure a very high chance of having a child in the future, close to 90%. Okay, so for this group of patients less than 35 years old, 20 eggs will be fantastic, but equally having minimum 10, ideally around 15, should be enough to ensure a chance between 70 to 85%, of course, which is interesting to see. Of course, is the more, the better, okay? If we move to patients around 37 years old, 20 eggs will still fine, 75%. And it's true that beyond 39, 40 years old, chances, they are reduced because of the loss on egg quality. And the same quantity, 20 eggs, For a patient at 42 years old, it will give us a chance of 37%. Okay. Going further, or seeing in another way, okay, as we've said, which is the ideal amount of eggs to keep, as we've said, 34 around 11 to 13 eggs, 37 close to 20 eggs, as we've said, 18, 20 eggs. And to have the same chances at the age of 40 will need almost double, okay, between 33 to 37 eggs. Of course, many times it's not easy to achieve those numbers. My specialization, as Barbara has said, it's mostly on low body reserve. And of course, we have, for patients that truly needs to have a large quantity of eggs, we have specialized strategies, double stimulation, specific protocols, supplements, additions of add-ons, treatments, in order to ensure achieving that quantity. Okay. Let's continue. And another question that some patients have is, okay, we're talking at least having a child, but what happens if I wish to cover the chance of having two? In that case, it's far more difficult to calculate, but roughly here you have the statistics, okay? For 20 eggs, we remember that the chances of having a first child at the age of 34 was good, 90%. For 2 children is still good, 66%. At the age of 37, remember, for 1 child, 75%, for the second, less than 40%. And at the age of 42, if we remember, 20x was 42%, 37% of chances, sorry, for 2, of course, it's much reduced, 7%. Good. Another interesting information, more about the theoretical frame, no? It's true that it's probably too soon to tell, okay, since this type of treatments, they are, let's say, widely offered from 2015, 2016, where the techniques of vitrification were totally available worldwide and optimized, okay? But our data suggests that currently around 1 every 4 women, 27% of them, they return to use their eggs. Probably that percentage will increase on future. Well, this is the information that we have right now. And it's true that many of them, they use donor sperm, but another percentage, they use sperm from a partner, where, of course, they have a tend to conceive naturally, but they haven't been successful. So that's why they have the chance to use the eggs when frozen when she was younger, and of course enhance the chances of having a successful result. In terms of, and this is an interesting question as well, how is the performance of these eggs once we decide to use them? And we've seen that in general terms, the results are compatible to fresh eggs. Okay, so patients at the same age, let's say at the same age when the eggs were frozen, or patients at the same age that they use their own eggs in fresh, they have similar results. So it seems that freezing and thawing the eggs, they seems not to affect the chances. It's true that thawing eggs, its survival rates, they are not always 100%. We have a survival rate close to 90%, so it's normal to lose some eggs during the process. But in general terms, that does not affect the final result, okay? And comparing to, again, to children born naturally or children born after IVF using eggs in fresh, we haven't seen any risks for the health of the baby. And as we have said before, the main risk involved on this treatment are the stimulation, because of the side effects that we have discussed. And probably it's interesting to stop on the egg retrieval. The egg retrieval, of course, as we've said, is surgery. In general terms, the risk of serious complication is very low, 0.02%. That means 2 every 1,000 egg collections performed. Risk factors are hyper responders and more aged patients, but in general terms is a very well tolerated treatment. Well, it's interesting as well about to discuss about ethical considerations. About, of course, this is a treatment that it's intended for patients that they like to expand, let's say the effective reproductive age, and what needs to be assessed by each, let's say, healthcare system in each country. It's who has to pay for it, the cost and the access, because we have countries as France where the let's say the public health system perform this type of treatment. Is true as well that they have a long waiting list, and other countries where most of these treatments are performed by private clinics, as is in the case on Spain. Just to finish, take home message, very important. As we've said, we need to keep in mind that this treatment is possible to perform in any moment, but the optimal results are obtained always when it's performed before turning 35 or at the age of 35, okay? Clear message, the more eggs, the better. Of course, it's difficult to achieve 100% sure of having a child afterwards, but of course, if we have a satisfactory result, chances will be very high. And once these eggs are kept, of course, that provides a lot of reassurance and flexibility for the question about motherhood or childbearing. And last things, we've talked a lot about medical aspects of the treatment, but I'm proud of course, presenting my clinic, Reproclinic, placed in Barcelona. As we've said, medical factors are important, but also accompaniment is an essential part of the treatment. And truly, we are proud about our clinic, since we offer a very personalized and careful treatment to all our patients. And of course, we have an holistic approach, not only, as we've said, about the medical aspects, if not to the whole psychological and full body, let's say, assessment. And basically, that was our presentation. So I will be happy to answer the questions that the audience may have.
Thank you so much, Dr. Moreno. It answered lots of questions for me. I've also been scribbling away in the background with lots of other questions that I think perhaps patients might really like to know. So as far as I can see, we haven't got any questions in at the moment. So if it's okay with you, I'm going to start the ball rolling and just ask some questions that I think patients may be interested in, or may want to know the answers to. So as I was scribbling away, actually, and you were going through your slides, lots of the things I was thinking about you were already answering, so that was fabulous. One of the things I did wonder was, I know that patients will be keen to know how long their eggs can be stored for. So
it's a good technical question. The fact is, when the eggs are collected, they are we freeze them through this process that it's called vitrification. Vitrification is a very quick step, passing from 37 Celsius degrees to minus 180 Celsius degrees, and using a cryoprotector that allows the egg to have any kind of risk of being damaged by the ice crystals. So once it's put into vitrification, it could be kept for many years. In fact, we're using eggs from more than 10 years ago and having results and performance as the fresh eggs that we may collect the same day. Okay, so there is, let's say, no theoretical limit to keep these eggs in vitrification.
Okay, perfect. I think I seem to remember in the UK now that the period of time that they can be stored for has been extended quite significantly. So I'm not sure if the same applies to Europe, so I'm not going to mention the numbers, but certainly I think there's been a significant increase in the number of years that eggs can be.
Exactly. So we need to understand that probably that in each country they may exist any, let's say, administrative limitations on keeping them.
Yeah.
But theoretically, what matters about the results, we haven't found a limit about the vitrification.
Yeah, so the vitrification, it has, I think it's transformed freezing of both eggs and embryos. My understanding of it is because of that reduction in the risk of ice crystals forming. So that's been transformative, I think, in
Exactly.
terms.
Exactly.
Yeah.
And as I mentioned, survival rate for eggs is quite high. It's around 90%, and for embryos, which is not bad to do, but it's interesting as well, it's even higher. Normally, nowadays, around 95, 97% of embryos, when they are exposed to the thawing process, they should survive and work well.
Amazing difference, amazing difference. So I have got some questions. I'm going to stop my own questions and I'm going to ask some of the questions that are popping up because they're far more important than mine. So we have, I didn't attend from the beginning, this is Haifa, but still have a question if possible. At the age of 47, is it possible to freeze? Also, how long can the egg be kept, which we've just been discussing? As I remember, one has been kept for me from 10 years ago. Is this still valid?
Yes. I mean, we have to distinguish technically. For sure, we'll need to assess the ovarian reserve of a patient at 47 years old. So technically, it's possible to be done? Probably yes. It's worthy? Probably not, okay? Because beyond, in general terms, beyond 45 years old, chances are close to zero. Even between 45, it's quite difficult to have a positive result, okay? Once, as we've mentioned, once the egg is frozen, it could be kept for long-term storage, and even though it has passed 10 years or more, probably will be still valid since the condition when it's kept in vitrification doesn't change.
So that's certainly, it sounds as though it's something worth exploring further to see. I mean, I would say it sounds as though there's only one. My guess is it would have been helpful if there were more than.
Since from the moment we have the egg until having a competent embryo to be transferred, there are many steps in the middle, exactly. So fertilization, the evolution of the embryo in the laboratory, afterwards being transferred. So having just one egg probably will, I mean, there's nothing impossible, but chances will be not very high, of course.
I'm guessing that you would be happy for Eva to contact you and have a discussion.
Absolutely.
Afterwards, because then you'll be able to provide much more individualized support. So, yeah, that's lovely. Thank you for your question and thank you for answering it. That's fabulous. So we have Maria. What is the expected success rate for someone who is 38, and how many eggs do you think are needed?
Exactly. The second question, it's the key point. No, I mean, as we've said, egg freezing could be performed at any moment. The only thing is that the later we do the treatment, the more eggs will be needed, okay, to achieve the same percentage of success. So roughly at the age of 38, to achieve a minimum of 70% of chances, will be need 20 mature eggs frozen. So my advice will be in that direction. If it's possible to have them in just one round, fantastic. In case that we do not achieve these numbers, always is possible to perform a second round, back to back, or some months after.
Perfect. You've actually answered her second question because she has asked, do I need multiple cycles?
Exactly. In case that depends mostly. I mean, it's not the most common, but there's women at the age of 38 having an excellent ovarian reserve that maybe they will have enough with just one round to achieve these numbers, but this is going to be not the most common case. So in that case, another important message to take home is, of course, each patient is free to do what they wish in terms of how many rounds, but my advice is truly, if you're willing or you're considering to do this type of treatments, it's worth it truly to arrive to a certain percentage of warranty. It's not always easy, but I believe it's a important message to keep.
And I guess as well that the other thing to consider there is, is whether you're considering just one child or a family, or you want to have more than one child, because that changes the the numbers.
Yes.
And yeah.
As we've said, many patients, they ask, and how many rounds or how many eggs I will need to do if I wish to have enough eggs to have potentially 2 child. As we've said, it's far more difficult to calculate since the experience is less than with 1 child, of course, and there is no a linear, let's say, a relation. No, so for the second child, depending on the age, we'll need much more than for the first.
Yeah. That makes complete sense. That's very logical, I think.
Mm-hmm.
Thank you. We have Mag, who has said, I had such pain the day after egg retrieval. What could it be? There were 20 eggs collected.
Yes.
She's talking about pain afterwards.
As we've said, we have to understand that we have to distinguish, serious complications or let's say more common complications after the surgery. It's true that the more traumatic, so the more follicles, the more eggs we have to collect during the surgery, the more traumatic is for the ovary. Okay, so in this type of surgeries, it's unavoidable. Then when we introduce the needle into the ovary to aspirate the eggs, always a little bleeding happens now inside the belly, not through the vagina, if not inside the belly, and that bleeding could provoke certain irritation inside the abdomen cavity and provoke pain. Okay, this is normal. Most of times is easy to be controlled with just painkillers, but it's true that, for example, in a collection where 20 eggs were collected, let's say it's a significant quantity. So most of the times what happens is that this little bleeding that happens during the intervention and sometimes some hours after the intervention as well, and provokes this irritation and pain. As we've said, most of the times it's normally easy to control with painkillers and some rest. Okay, but of course we advise our patients, if truly after surgery you feel pain which is not well controlled with painkillers or any other symptoms, fever, just for sure get in touch to us as soon as you can.
So would there be an argument there for perhaps doing two different egg collections, so kind of reducing the numbers if there's the risk there of being increased pain?
It could make sense. It's true that most of times we try to obtain the best result. So we need to be aware that these patients that are in risk of having more complications are patients with normally normal or even high ovarian reserve, where the stimulation produces many follicles. Okay, it could be a strategy to reduce the risk of pain or complications, to perform a mild stimulation, and in case of needed, to perform a second round. But probably if we take into account the risk, probably we have less risk of complications if we perform just 1 egg collection than if we perform 2 possible egg collections for the same patient. Yes. Since most of times, even having a high response, most of the times we do not have, as we've said, serious pain or complications afterwards.
So it sounds to me really then as though it's about pain management, isn't it, post-procedure?
Correct.
And there are effective ways of managing pain post-procedure.
Exactly. And this is not going to happen equally to different patients. So as we've said, the more response, the more risk of these complications.
Yeah, excellent. So I'm just going to, before I move on to, there are some other questions, but I'm just going to go back because Mag has also come back and said, do you have a limit of age or is it based on AMH levels? I think that's what she's saying. It should be AHM, but AMH levels, yeah.
Probably both are equally important. Let's say, as we've said before, technically, the limit will be probably having such low AMH or ovarian reserve that even performing the stimulation, we do not obtain any response from the ovaries, any follicle. Okay, that's the theoretical limit. But before that, of course, we need to discuss. We need to sit down on consultation and discuss if, after a certain point, after a certain level of AMH or age, if it's worthy or not to do the treatment. So in my opinion, this advice should be individualized, but for egg freezing beyond 42, 43 years old, or with an AMH less than 0.2 or 0.3 nanograms per milliliter, it's maybe difficult to have a good outcome from this situation. Okay, it's true that it's not always easy because we have very young patients with extremely low ovarian reserve. Okay, in these patients, in spite of having a low AMH, maybe if we perform 2, 3, 4 rounds and finally we have 6, 7, 8 eggs, that's going to be enough to ensure a good percentage. And on the other hand, for example, we have patients at 42 or 43 where they still have an excellent ovarian reserve. They are capable to produce many eggs, 15, 20 eggs per round. So maybe it's still worth it to try, since another techniques will help us to select very accurately which is the good embryo to transfer. No, so that depends mostly in each patient. Okay, but the combination of age and low ovarian reserve, probably that's the limit. No?
Yeah, and it has to be individualized.
Correct.
Absolutely has to be.
Correct.
Yeah, of course. That's really helpful. Thank you. So Hava's come back and said she's had an assessment recently. The doctor said, I have 2 eggs in the left ovary and 7 in the right. How possible is it to still achieve success for IVF if it's done soon?
Right. I mean, what you're describing is it's a test that is called antral follicular count. It basically consists on assessing how many of these follicles, if you remember what I was explaining, the structure that we stimulate that make them grow, to afterwards be collected. So your doctor sent you that you have 9. Okay, there's an essential information here which is missing, and we don't want to be not polite, but age is important to be asked to answer the question. But 9 follicles in general terms before 35, it provides a good prospect. At the age of 40, it's probably still higher than the average of women at this age. So it's not about result, let's say. Of course, as we've said, other factors should be assessed as well. Here, I believe that the patient, you have asked about the prognostic of the IVF. So remember, IVF is not only the egg, sperm should be assessed as well, the health of the uterus. So there's many other factors involved as well.
So that it sounds to me really as if it would very much make sense for Hava to contact you directly.
Mm-hmm.
And so perhaps at the end we can just give an email address, so that if that's okay with you, so that she can make contact. That would be really helpful. Fabulous. Maria has come back and said, can you tell how often, this was one of my questions because I know this, I knew that somebody would ask this question. So how often do women go through social freezing and then actually use their eggs, and are there any studies that have been done that demonstrate how often those eggs are actually used?
The data that I showed you, this 27%, they came from the SART register, which is the North American registration of IVF activity through the whole clinics on the country, 27%. And in Spain, we have the registration of the Spanish Fertility Society, which in that case is a little bit less. It's around 23%. But again, probably most likely this percentage will be increased in the next years.
Yes, yeah, things change all the time as we understand things in a different way and knowledge is gained. So it's really important, I think, to keep revisiting these things because they do change. They do change quite dramatically as we start to understand more. That's lovely. I am just wanted to open up the topic of organizations, companies, employers who are actually funding social freezing, because we are seeing an increase in that in much younger women who don't know what their reproductive life is going to look like, and are deciding, quite early on to take advantage of that. And of course, it's then funded for them. So I just wondered what your views were on that, and what, etc.
Not an easy question to answer because there's many considerations. Of course, I believe that it's a benefit that enterprises offer to their women workers. It's always interesting to offer an option, but we do not need to forget the implications that it have later motherhood in terms of just taking into account medical aspects, so no risk of complications during pregnancy, health of the future baby. Mostly that. Afterwards, there is a big, controversial discussion, let's say, about motherhood in later years. Honestly, I believe that everyone is free to decide about when wish to be pregnant or to become a mother. So for me, there is little discussion about that. Mostly, it raises concerns about the health of the mother and the baby.
Yeah, absolutely. It's just, I thought it was really important to broach it as a topic because what we see are these, as you know, we see these trends, and it becomes something that becomes very popular because it's being offered, and that's why this session particularly is so important, because even younger women who may not consider that they would have a reproductive issue may be considering freezing eggs. So and I really feel quite strongly that they need to be making that decision and be very well informed when they're making that decision.
There is an interesting discussion about as well that I believe that it's the common understanding that motherhood will be possible even until very late years, and truly there is a misconception about that on society. Okay, we truly treat patients that basically they have come to a clinic because they decide to become mothers when they still thought they have positives, when truly biologically it's very difficult. No? So it's maybe important to talk about that. I believe that the point is to give assessment. Okay, women to go to their professionals, healthcare, to check ovarian reserve, to discuss about the plans on future, about maternity, and making the decision based on that. Of course, egg freezing is a very, very useful tool. So, but again, accompanying and advice, I believe, is the key point.
Yes, absolutely. So I am guessing that if you have, we've talked about lots of different scenarios that women may decide to freeze their eggs. There are lots of different reasons, but I'm guessing that the most important thing to do when they are making that consideration is to make contact with someone like you, so that they can then find out what their individual risk factors might be, what their individualized success rates are likely to be, and also what their family might look like. Because women tend to think of initially it's like, well, I would just like to have a child, but actually if you're younger, you may want to have 2 or even 3 children, and that may not be possible if you leave it until later.
Absolutely agree.
So I'm guessing, I'm just saying from my experience and my understanding, it's that individualized understanding of your own scenario, and having conversations with specialists like you is really important before you make those decisions.
Absolutely right. Absolutely right.
So, well, I think we may have come to the end of all the questions that are here, and I think I've probably covered all the questions that I scribbled. So I think we probably have come to the end. But could you just give us an email address for anyone who's listening, so
if you can display the last slide on the presentation, I believe that there we have the email address.
There we go. Lovely.
Exactly. Fantastic. There, well, at least you have there the link to our website.
Okay. Perfect.
And email address where you will find it easily in our website, or at least a contact form.
That's perfect. That's absolutely.
And this is sorry, I have to say my excellent and amazing team of gynecologists and partners that we work in Barcelona.
That's lovely, and it is lovely to have a wonderful team to work with. Teams are what make everything work. It's always so important, isn't it, to have a team to work with. I know that from my own background, so it's lovely. So I just want to say thank you so much on behalf of the European Fertility Society and my IVF answer. Has been absolutely fascinating. Thank you so much for sharing your expertise with us, and I'm sure that people are going to find this enormously useful when they are making those decisions about social egg freezing. So huge thank you to you.
Thank you, Barbara, for the time that we spent together and for giving me the chance to participate in this initiative. I'm happy for sure. Thank you very much.
Such a pleasure. Such a pleasure. Take care. Have a good evening.